former MEC for Health in Gauteng, Dr Bandile Masuku, wants the findings of the investigation into the multi-million rand personal protective equipment tender to be set aside. Now, on Friday last week, Masuku filed court papers to dismiss the Special Investigating Unit report. The report found that Masuku was guilty of failing to execute his duties, thus violating the Constitution and the Public Finance Management Act. Masuku said that amongst other issues, the SIU had made erroneous findings and had been peddling falsehoods. So to discuss this further, we're joined by Dr Bandile Masuku's lawyer, Mojalefa Motalane. Thanks so much for your time and welcome to Morning Live, Mr. Motalane.
Hi, good morning, ma'am.
So firstly, your response, to all of what has been said and the charges that has been brought against Dr. Masuku and the fact that he's been removed from his position. Why should all of these be set aside?
Well, as you know, the reasons for Dr. Masuku having been requested to step aside from his position is with regard to the findings that were issued by the SIU, which findings we have now taken on review on the basis that our view is that they do not, in fact, correlate with the facts and the evidence at hand.
And what exactly are those? Because you also charge that the SIU have made some erroneous findings and that they are peddling falsehoods. What exactly are those supposed to be?
Well, according to the SIU, Dr. Masuku has breached provisions of the Constitution and certain provisions of the PFMA. Now, in our view, we don't believe that they made reference to the correct provisions of the PFMA with regard to the executive authority, which is the responsibility of Dr. Masuku. They have assigned to him certain responsibilities and obligations, which should have never been applicable to him in the first instance. Those responsibilities apply to the accounting authority. And that's the distinction that the SIU fails to make and have, by their findings, accorded him fault on the basis that he should have done things that were never applicable to him in the first instance.
Can we get more clarity on that? Because one of the issues that stood out there was, of course, that he had failed in his oversight responsibility. Are you saying, therefore, that he had no responsibility in that regard?
He absolutely had a responsibility, and the PFMA is quite clear in terms of the executive authority's responsibility, which is to run the department at a strategic level, and the executive there being the HOD and the CFO, amongst other people, to report to him on a regular basis with regard to the operations of the department. However, there are specific responsibilities that apply to the accounting authority, which do not have anything to do with Dr. Masuku as an executive authority overall responsible for the department. So those are quite distinct and quite clear.
But give us examples of this, please. Please give us examples of that.
Yeah, so for example, the HOD in the department is responsible for the day-to-day operations of the department, including supply chain management, human resources, amongst other areas of day-to-day operations of the department. Whereas on the other hand, Dr. Masuku is responsible for the strategic oversight and management of the department. And we've also laid this quite clear in our papers as to what actually encompasses his responsibilities.
So one of the other things you said is that you don't believe that the SIU actually issued a report and that it was a letter. Is that quoting you correctly? And if so, what do you actually mean by that?
Well, what we mean is that the SIU wrote certain letters to the Premier and have effectively not issued a report, although in those letters that were issued to the Premier, certain findings which are final in effect were recommended, and therefore hence the Premier was able to take certain action.
Mr. Motalane, what are your clients' views on this whole tender scandal overall in the Gauteng Health Department? Does he admit to any wrongdoing at all?
Well, I think that's a bit of a vague question. However, our client is obviously, just like every South African citizen, concerned about acts of irregularities and maladministration that have, in fact, taken place, and is committed to make sure that those kind of activities, are resolved and taken care of, and the responsible people, the correct responsible people, to be held accountable. So, in as far as is relating to him as an MEC of the Department of Health in Gauteng, he's of course very concerned and of course does not agree with the fact that maladministration should have taken place in the first instance.
So there's an admission that maladministration took place. This happened under his watch, in his portfolio. Does the buck not stop with him?
I've just explained the distinction between the executive authority and the administration within the department. And I think that's very clear in law and also in practice. And what is the responsibility and what the MEC ought to have been held accountable for if there's any allegations to that effect. But I think where we're sitting right now, and I'm sure you've also come across an independent report issued by Mr. Paul O'Sullivan, which has effectively cleared the MEC and has also scrutinized some of these areas that I'm referring to with regard to the responsibility of the executive authority versus the accounting authority.
So what responsibility, if any, is your client willing to take with regard to all that has transpired here?
I'm not sure I follow your question. Perhaps
I'm asking.
You may want to rephrase. Yes.
I'm asking because with all the admissions that you say, making the distinction between who should be responsible for what oversight and everything that happened in this tender scandal, what, if any, responsibility is your client willing to take with regard to this whole debacle?
Well, I'm sure, as you would know, the matter now is in the courts, and the SIU is also said to be continuing in its investigation. So I think it would be a bit premature at this point to delve into that particular point. However, we've made it clear the responsibilities of the MEC as relating to the events that have unfolded, and he's explicitly stated his role, his responsibility, and the level of accountability that ought to have accorded to him.
Mr. Motalane, in the end, what is all of this in aid of? Does your client want to be reinstated to his position? Does he want to clear his name? What exactly is the end game here?
Well, this is effectively in aid of, clean governance. The fact that to the extent that the SIU, as an investigative body, is expected to conduct investigations, ought to do those investigations in an administratively fair process and in a manner that actually results in substantive findings, against people that ought to be found, responsible for having not taken appropriate actions to prevent some of the things that we're discussing now today. So we have gone to court, to try and correct some of the findings that that the SIU has made, so as in fact to assist the process, so that they are able to make correct findings and determinations that will actually help all South Africans to feel and see that actually there is a concerted and proper fight against maladministration.
And in the end, does your client want to be reinstated to his position as MEC?
That is the prerogative of the Premier, and our client has accepted that view, and I think that's the common cause generally that as a society we accept in terms of appointments at that particular level. Our client's secondary concern is his professional integrity and personal reputation, and hence he's also taken this action.
Well, thank you so much. That was Mojalefa Motalane, the lawyer representing former Gauteng Health MEC Dr Bandile Masuku, and discussing his client's wish to have the SIU PPE tender corruption report set aside. And as you heard there, saying that it actually wasn't even a report. These were letters that were sent. And his client feels that they were falsehoods that were peddled and trying to have those set aside.